Good morning. My name is Tiffany Smalkoski and I'm a dentist here in Racine, Wisconsin. And I am here to talk to you today about some of my products that we offer at the office. Both myself and my mother offer many products in our office, and such as Botox, Juvederm, Volbella, Voluma, Kybella. Well, it sounds like we're speaking gibberish right now, but I'll explain all these things. I get a lot of questions about where do you put something? How long will it last? Can you do something here? What is it that you're putting in my face? So a lot of these interesting questions we go over and over with, and it's important for patients to know what they're putting into their body. The Botox, a lot of people think it's like botulism that would be placed, that paralyzes animals. And it's not the same thing. What happened is they took the protein that causes that botulism and they collected the protein, they studied it to be able to decide how we can use it on each other. I know it sounds kind of weird to be able to take a protein like that and change it for our benefit, but they created a protein called Botulism toxin A, which is a product called Botox, which people put in their face to stop wrinkles. And it travels in the skin about the size of a dime. It doesn't go anywhere after it gets processed by the body. After about 3 months, it goes away, and that material gets excreted through the lymph system naturally in the body. So let's go ahead and go over some areas, starting with Botox and how to use it. I'll get a lot of questions about, is this something you can put Botox in? Well, that's a filler. If you're gonna stare at yourself like just making a plain face, what wrinkles do you have when your face is at rest? When your face is at rest, that is something I can plump up with Juvederm. And that's an amazing product made of hyaluronic acid, which is naturally found in your body and in your joints to help some movement. That they'll actually place underneath the skin to plump up a wrinkle that looks deep. You can use them on areas right in around the nose, around the chin. You can do a little bit of these deep lines if these, what we call our 11s, get pretty deep. You can use it in a lot of different places. So let's start out with Botox. Botox can be used to stop a wrinkle from forming, and if you can't make the wrinkle, you essentially break the wrinkle. So like a lot of people will talk about the 11s right in here. If you can frown, like your mad face, if you can frown and you can make that area, there's a muscle here called the corrugator, and then the center one is the procerus, okay? And it kind of extends from about here to here. So that area that kind of pulls down and in, and that's why it'll make that 11s. I know I look goofy, but it's for your benefit, trust me. It'll make this whole area kind of relax a little bit. So there's 5 injections that we do in that spot, and it's roughly about 20 units. And it's usually 4, 4, 4, 4, and 4. That area will prevent you from frowning down, okay? Now, naturally, because you can't frown down, your frontalis muscle up here will continue to work. So some people, when they say they're getting their Botox and they just get this 11s area done, they're going to end up getting this Spock look that they're worried about. Some people get it, some people don't. Some people are worried about it, some people don't care. Some people want that area above their eye to be lifted a little bit, so some people really enjoy it. Everybody's muscle is different, so some people really like the look of it and some people don't. But what we can do to counteract that and make everything nice and smooth is to do just a couple units, 8 to 10 units in the forehead, and that calms everything down up here, so this doesn't move as much as well. So you can't kind of frown down and you can't raise your eyebrows. Yes, I've got my Botox. I'm doing it in a couple weeks, but I got some movement here to be able to allow you guys to see. Okay, so that frontalis, the corrugators, and the procerus muscle we've gone over. Now we want to go over, it's called the orbicularis oculi. It's all around the eye, so that helps you be able to move those muscles. Now, the muscle originates here, goes around and inserts right inside the middle of the eye, and it makes it it's so we can squint. Now, in order to not squint and to not get those crow's feet that everybody talks about, We do about 10 to 12 units on the sides of the eye, roughly in this area in 3 different injection spots. Now that's going to prevent those crow's feet from happening. I'm about due, so they're coming back. But at least you can see how the movement goes. And we usually do 10 to 12 units right in that area. Some people will say too, sometimes when they raise their nose, we can also put Botox in this nasalis muscle right in here to prevent you from lifting your nose and getting these extra wrinkles that cause in here sometimes. All right, on to what we then call the lip flip. Now there's a muscle that goes all the way around the lip, and it's called the orbicularis oris, okay? That muscle allows us to make that funny face. Okay, so sometimes people will call them the straw lines or the smoker's lines, and those will form in this area here. We can stop that. So we end up either placing 1 unit in each of these spots to help relax that area and to help those smoker's lines not form. Also, we can do the lower lip. The upper lip is more common, but sometimes when people do Botox on the lip, they tell me it's a little hard to like drink if they do the lower two. So that's something that you kind of look out for. Relearn your muscles, and I like to do just my top. I like to do 1 unit here, 2 units here and here, and 1 unit here. And it just it relaxes the upper lip a little bit. Plus it also gives you something called that lip flip. And it's not like your lip's gonna like flip inside out. What happens is it makes the lip almost look just like the middle of the lip kind of drops down a little bit, and you get a little bit more fullness to that lip. A lot of people like that. A lot of people like that. You can also do the muscles on either side of the nose, right in this triangular area right in here. And that area will end up lowering your lips so you don't have so much of a gummy smile. A lot of people, when they smile, they show a lot of upper gums, and they're not comfortable with that. So what we end up doing is adding about 4 units right on either side of the nose in that area to keep that upper lip down. When we do anterior crowns on a patient and we do all of their teeth in front, a lot of people don't want to show the gums. If they're spending all that money on their teeth and they have a really gummy smile where they kind of show everything, we can calm that down. Granted, it's every 3 to 4 months because that's how Botox works. But a lot of times it's so worth it. So those are those areas. Then also right in this area is called the depressor anguli oris, and that prevents you from frowning down. That muscle kind of connects right in this area, down in here, and we can inject here to prevent the turn down. Some people that works really well because when they're resting and they're looking at themselves in the mirror, they'll almost look like their mouth is turning down, and that makes some people uncomfortable. They'll almost get like that bulldog look. I should really know other way to explain it. Where that muscle will kind of relax a little bit so you can't turn your mouth down so much and your smile kind of increases. It's pretty cool. Also, let's see, the mentalis right down in here. You can move that muscle right in there. We can inject the chin. Some people get a little bit more of a wrinkle here than they're happy with. So that's important to get rid of if it's something that bothers you. And if we can, why not, right? That's one of the other areas. Also, some people really like it if they get like these platysmal bands, they're called, and they kind of like stick out every now and then. Some people, they stick out more. And it just bothers people. Well, we can soften them by putting some Botox in your platysmal bands. Some of the materials that we offer in these areas here is also Juvederm. Juvederm is an amazing, actually, let me backtrack. One more thing for Botox. If you have TMJ problems, we can do this masseter right in here. If you can go ahead and bite your teeth down together really hard, you'll be able to feel this muscle right in here. Okay, sometimes 15 to sometimes 30 units of Botox per side will help you with your grinding. And that really helps with headaches and stuff like that. So that's really important to think about. If you're gonna end up, there's a lot of people that don't do Botox anywhere on their face, but they end up doing it in their masseter muscles. and it really helps with grinding. Sometimes you'll get that flat tooth look where when you're grinding your teeth, your teeth wear on one another because of the strength of this masseter muscle. It wraps around the lower part of the jaw and it kind of lines up. It swings up and over and grabs the top of your zygomatic arch, kind of holds on to everything, kind of hits right in here. So when you bite down, you can feel it. It goes all the way up. As you bite, you can feel your whole muscle go crazy. I'm a grinder, so I can feel mine. Mine's pretty thick. And that muscle will get very sore. So you can also put Botox in a couple different spots here to help soften that. And it kind of saves your teeth sometimes, depending on how heavy you do it. All right, on to Juvederm. Juvederm is a plumper. There's Juvederm Ultra, there's Juvederm Ultra Plus. Those two different products are awesome for filling any wrinkle that you have at rest. So you can fill up the lips, give yourself a little lip addition, a medium lip addition. You can go big or go home. It just depends on what you do. But it's really important to work with your provider to get it done right, get it done appropriately, get it done so you look like you, just maybe you think a better version of you, maybe what you look like maybe 6 years ago. I mean, a lot of times there's some people that are kind of so far into aging that sometimes it's better to work alongside a plastic surgeon, and that can be a really good partnership if you have somebody in your area that might be able to nip and tuck, and then you can make the addition of the Juvederm to kind of fill in those areas that weren't 100% of what the patient really wanted, but the two will work nicely together. Okay, so Juvederm, a lot of times I like using velour underneath the eyes. So we can end up filling in this little troughed area under here. You can use Juvederm, it's a little bit more of a thicker product, but Volbella or velour work really nice in this area. It's a little bit thinner. And what I like about the Juvederm and Allergan products is that they're clear. And some of the products are white, like from other companies. They'll be white and they'll kind of show a little tinseling through the skin. One of my favorite products is the Juvederm products and all the Allergan, Juvederm, Ultra Plus, all that stuff. It's because it's clear. You put it underneath the skin and it looks so natural. It's so awesome. And it lasts, I probably get mine done about every 18 months, 2 years sometimes. So that really helps. But you can use velour or Volbella right in this area, okay? That will give you a nice plumping. You can also use that same material along the edge of the lips. You can use it in any of those smoker's lines that you might have. That's a great spot to use it. Next we have Volbella. Next we have Voluma. Let's fix that. Okay, so Voluma is a material that's a little bit thicker than Juvederm, which is really amazing because you can place it along this zygomatic arch bone of your cheeks, and you can almost give yourself a little bit more definition in this area. As we age, what happens is everything kind of falls a little bit. So what we want to do as we get into our 30s, 40s, 50s is lift it back up to where it was. And those are kind of seems to be one of the main things that I get when people come in is, put me back where I was. Well, we'll do our best. But a lot of times this is where people will go for. Sure, you can end up adding a little Juvederm in some of these side lines, but a lot of times the Voluma will give you the definition that you're looking for. A lot of times I find with Voluma, a half a tube and a half a tube doesn't seem to be enough. It's almost like we just kind of need to stage it in different spots and give you a little bit more of a rounded cheek. And really is nice. It's a great product, and most of my patients get it done every 2 years. They'll feel like, oh, I'm getting a little flat again, and then they'll get that done. So it's a great product for that. Another product with the Juvederm, you can end up doing the sides here of your face. you can end up doing, they call these the nasolabial lines. These are called the marionette lines. You can fill those in too. You can maybe get some fine lines and wrinkles in this area. A lot of times people, if they get a little indented along their jowl area, we can put a little Juvederm in their jowl to fill them out a little bit. We can use Juvederm in these 11s. Sometimes if you have deep forehead lines, one of my favorite ways to use Juvederm is if you have like any scarring, like any indented scarring. That is so awesome to be able to use Juvederm in that area, because what used to be a little indented, we can go underneath that scar and place it, and it will lift that tissue up and it will give it just a little bit more definition. Sure, the scar might be there. You put a little frankincense on that, but the scar will just all of a sudden be flush with the skin and not be an indent, so it will cause less shadowing, and that's awesome to be able to do for patients, because maybe they'll have had stitches through their eyebrow when they were younger, and you'll say, hey, I can put some Juvederm in that, and they'll be like, what? And it's when you make the patients the happiest, when you end up surprising them with something that they didn't know you could do. So I feel like this video was kind of necessary, and I can kind of detour some of my patients to the video if they haven't come in and they want a consultation real quick, and then they'll know what they want before they come in, and we have better things to talk about. It's really a lot of impressive products when you're working with Allergan. There are a lot of great things. Another thing that I have also had done is Kybella. We offer that treatment in our office. So when you are kind of bending down and you feel any of this fat that you can grab under your chin, we can inject it with a material called Kybella. It usually is 3 to 4 treatments, and that area we will kind of inject a material called an adipolizing material, which means adipose means fat and lysing means to kill. Sounds funny, I know, but go with me here. We inject this material in here so it kind of attacks those fat cells, breaks them down, and ends up kind of settling in here. There's a little swelling for, I would say, about 2 or 3 weeks. I really lasted mine. My first treatment, there was swelling for 2 or 3 weeks. The next treatments after that went a lot faster away. But after that fat tissue is lysed, the lymph system of the body takes the rest away. So there's a lot that material does, and it works really, really quick, really fast. Some swelling, it didn't hurt. It just stung a little bit right when it went in. But then for the rest of the day, you just kind of get a little swelling in here, and it kind of feels a little jiggly. After that's done, we can do some PDO threads up in this area. That's for another video, but we'll go there soon to kind of nip and suck that area up a little bit. So I hope this helped. I wrote down some notes here. It looks like I went through everything, but a lot of really great products to start using, and Juvederm and Botox are amazing. Botox is going to be about every 3 or 4 months. So that's something to keep in mind too. So it can be a little bit of an investment, but even if you don't have the wrinkles, prevention is key. And then also with the Juvederm products, I would say I like to do my lips every year. I like to do my cheeks maybe every 2 years, right in here with that Voluma. And just a wonderful product. It's pretty great. But I hope that this helps and gives you a little bit of an explanation of what I like to do. And it's also, just remember where you're going to go get injected, because it's really good to go to somebody who has a lot of experience in what they do. Where I started out in dental hygiene school and I went to Marquette, and we had, facial anatomy. And then when I went to dental school, we also had facial anatomy. So there's a huge confidence there in knowing where things are in your face and how those muscles move, and placement of material and not putting too much. However, if we did do too much in your eyes, if you felt that we did and we needed to move something around or get rid of it, there's an awesome material called hyaluronidase. I have that material in my office. I end up injecting it in the same spot that we injected, and it dissolves the Juvederm, and it goes right away instantly. So that's a really neat product to do too, so we can balance everything out, where if you ever find like you're uneven in an area, when you come back to our office, we can end up adding to that side, or adding to the side that you're a little smaller, or we can take away from the side that you had. So a lot of really great things that we can offer. And just make sure that you work closely with your injector to make sure that everything is comfortable and that you're happy and that your treatment is exactly what you wanted. Because I've been used to be able to go to a place where I almost feel like I was talked into treatment, and you never want to feel that way. You always want to make sure that you know what's going in, you know what's going on, and that all of your questions are answered. So I am totally available for personal messaging, or what do they call it? DM me. You can send me a message and I can answer any questions. Or maybe we can do a virtual consultation. That sounds fun too. So let's go from there. And I hope I answered a lot of questions, a lot of muscles in the face, a lot of places to put fun things. So have a great day.